Our Children's Hospital's Solutions for Patient Safety Network has prevented hundreds of children from developing pressure-related tissue injuries. We have compelling evidence that shows if we reliably implement our SPS prevention bundles, we will prevent harm to our patients, and we are committed to doing just that. The Pressure Injuries SPS Prevention Bundle is intended to prevent pressure injuries and includes the 5 standard elements listed. In this video, we will walk through the steps for completing the patient positioning and appropriate bed surface elements of the bundle. First, clean your hands with soap and water or use alcohol-based hand sanitizer. Next, put on non-sterile gloves. After putting on the gloves, reposition the patient to offload pressure. Turn all immobile patients at least every 2 hours or timed with the care in the neonatal intensive care unit. Maintain the head of the bed at less than or equal to 30 degrees unless medically contraindicated. A patient who is mobile and or able to get out of bed may sit in a chair or upright in bed if physically able to do so. However, the patient's position must be shifted regularly to reduce pressure while in the sitting or upright position. Utilize positioning devices to redistribute pressure. Use your hospital's approved positioners to maintain the patient's body alignment in a 30-degree side-lying position. Use gel pads, pillows, and/or a pressure reduction device to cushion the patient's bony prominences. Be attentive to the patient's occiput, sacrum, elbows, hips, and heels, as these bony prominences are at risk for pressure injury. After utilizing positioning devices, elevate the head of the bed less than or equal to 30 degrees unless medically contraindicated. Then, remove your gloves and clean your hands. Finally, evaluate the need for a specialty bed by looking at the patient's skin risk assessment score, ability to reposition, and tolerance of repositioning. You can now successfully complete the patient positioning and appropriate bed surface elements of the Pressure Injuries SPS Prevention Bundle. If you reliably implement these best practices, children at your hospital will be saved from harm. Start today. Adopt these best practices and save children from harm, one child at a time.